when two egg cells are fertilized, each egg by a different sperm so that two embryos are formed. Fraternal twins can be of the same or opposite sex and they don't have to look at all alike. Identical twins are formed when one egg, after being fertilized by one sperm, divides into two halves. The two halves are genetically identical. Identical twins are usually of the same sex. Conjoined, Siamese, twins are formed exactly like identical twins, but during the split, the embryo does not separate completely to form two separate babies and the twins develop attached to one another. How twins are made. People are very fascinated with twins and other multiples. It seems mysterious how one pregnancy can result in more than one baby. Multiple pregnancies are on the rise in recent years with more and more twins and other types of multiples being born. The majority of the reason for this rise is the increased use of fertility drugs. How twins are made. There are a couple of ways that multiples are conceived. Multiple eggs are released or there is more than one ovulation. Both, or more, eggs are fertilized and you have fraternal twins. This can happen with or without fertility drugs. One egg is released but splits in two. Identical twins are made. This can happen with or without fertility drugs. In cases of IVF, there may be more than one fertilized egg put back into the uterus. The rationale is that not all of these will implant, though sometimes they do. Once conceived, you have a lot of possibilities on placentas, implantation locations, number of amniotic sacs for monozygotic, identical twins. For example, you can have two babies, two placentas, and two sacs. You can have two babies, one placenta, two sacs. It will be important to know exactly what you are dealing with, particularly when it comes to amniotic sacs. How multiples are diagnosed. Many people learn about their multiples at an early ultrasound. Although some critics say that before 12 weeks gestation there is still a high risk of vanishing twin syndrome, VTS, where one baby stops growing and is either absorbed back into the mother's body or is stillborn when the other twin is born. Some people find a rapid rate of growth in their uterus which leads some to suspect twins. I will say, for all of you second-timers out there, that your bellies will grow faster than with your first pregnancy, so don't automatically assume twins. Sometimes multiple heartbeats are heard, leading your practitioner to believe that there is more than one bundle of joy in your uterus. Some women find out when they have abnormally high levels on the AFP test that multiples are on the way, since multiple babies would increase the levels of these hormones.